One of the reasons why we're sitting here discussing cellulite is because our mothers 4 million years ago could make it through great crisis of starvation and hunger because they had cellulite, right?
But yes, but
they could make it out alive. Then women made it out alive and could breastfeed their children because they had pockets of fat.
That may or may not be true. I mean, it's. I like to agree with you, but at the same time, I mean, it seems to be stored there and the last to go.
Right.
But if you really just look at the cells themselves, they're really not different, the fat cells.
Now, Dr. Howard Sobel, or as you're known in New York circles as the George Hamilton of sun-tanning creams, because you bring out your own suntan lotion. How about diet and exercise? What the lady just said at the top of the show.
Diet and exercise definitely help, okay, but they just help.
What do you mean help? Like if you have mashed potato thighs.
You're not going to get rid of cellulite with exercise and diet alone. Okay, sure, you'll increase the muscle tone and make the cellulite, improve the cellulite and the appearance of it, but you're not going to make the cellulite go away. And actually, if you cut to a diagram, I'll show you what cellulite is. It's almost hard to describe it.
Let's look at this little diagram. Let's look and see what cellulite is. I think we're going to put that, there it is. There are female and male. Right. Okay, can you see that, doctor?
It's hard for me to see, but I guess now I can see it now. If you look at the female, you'll see that the fat globules are lined up in a vertical fashion,
right.
And you'll see these fibrous strands that run through the fat,
right.
And then you'll see small little globules that sort of poke through up into the dermis. And that's what you're seeing, is sort of a mattress effect. You see in the sort of a waviness of the skin, and what you don't see that in males. If you look at the males have a thinner network of fat. It's sort of a lattice network where the fibrous strands run vertical and horizontal. So if you pinch the skin, you don't get that sort of dimpling effect that you would see in a female. Like a quilt. Also, very important that the males, the dermis is much thicker. And because the dermis is much thicker, when you pinch the skin, you also don't see these protrusions of little fat globules.